All right, I think people will start filtering in, but Anne, do you want to kick us off and give some introductions?
Yeah, love to. Welcome, everyone. Thank you so much for the second meetup by the Delaware Data Innovation Lab. We were kicked off with a CARES funding back in October, and we recruited some amazing data scientists and fellows, and we've been doing some pretty powerful things on COVID up here in Wilmington, Delaware. So thank you for joining us today. I want to thank our sponsor, Compass Red, who's right here in Wilmington, for their continued support of the lab and its fellows. And I want to introduce Patrick Callahan from Compass Red.
Thank you, and I'll be real quick. So yes, Compass Red is a data science and data innovation lab. I'm sorry, it's a data science and data analytics company, and it's exciting to support the Data Innovation Lab and education's things like this. One of our values of our company is like, we need to build this community to be bigger and better and bring some of the brilliance into this space. So doing it through these type of events certainly spreads the word about this. We also have the Data John that the Data Innovation Lab will be doing, and then also meetups throughout the year once a month. So if you have ideas that you want to submit, certainly submit them. And if you have other ideas of ways we can get the word out to the community, definitely let us know. So I will pass it back on to Anne.
Thanks, Patrick. Just a little bit about the lab before we get to our real fun for the day. So the lab exists to engage local and global organizations in the ongoing conversation around the use of advanced data and analytics, artificial intelligence, to fast forward research ideas out of the lab and into communities, government, and the marketplace. Our vision for the lab, in addition to being a world-class innovation hub on the Eastern Seaboard, is to bring data analytics, data science, and the AI industry together and develop a diverse and inclusive culture. We believe that because they're still in their infancy, if we approach them with purpose and conviction and intention, that these fields can have trajectories that exceed the influence of past technologies when it comes to labor force, equity, community impact, and innovation. No one personifies the mission and the values of the lab more than our guest today. So everyone out there, you are in for a real treat, for an incredible hour of energy, brains, passion, and a phenomenal personality. Beth Blauer is the executive director and founder of the Johns Hopkins Center for Civic Impact. As a dedicated public servant and an international expert on government performance programs, Beth spent her career working to improve people's lives by bringing data into government's decision-making processes. Prior to leading the Center for Civic Impact, Beth designed and launched the GovStat platform for federal, state, and local governments. Having entered public service as a juvenile probation officer in Maryland, Beth was tapped by the then governor, Martin O'Malley, to lead his nationally recognized state stat program. Beth is a graduate of the University of Maryland and holds a JD from New York Law School. Beth will fill in a lot of these details, so get ready for some great stories. We here at the lab, Patrick, Devin, and I, have had the opportunity to speak with Beth and her incredible wingman, Trevor, who's out there. Trevor, thank you for everything you do. And we've had the chance to talk a few times this month, and they've been very giving with their time and their enthusiasm to speak here today. But we got a little concerned earlier this week when Trevor went radio silent and we couldn't get a hold of him. And we weren't sure where this dynamic duo had gone. And then we read the news. From the White House briefing room, dated January 21st, 2021, there was a national security directive that there is going to be a National Center for Epidemic Forecasting and Outbreak Analytics. And though nothing's official, and this is nothing at all, but we just thought that maybe instead of talking to Devin and Anne, that they might have been talking to Kamala and Joe. So wherever Beth Blauer stays or goes, we are all in very good hands. And please join me in a silent, but I know you're all out there excited to hear Beth Blauer. So Beth, thank you so much for joining us.
Thank you. Thank you for having me. I can assure you that I love Johns Hopkins University, and as it stands now, I'm staying put, doing the work that I love to do. I'm just so excited to be here with folks from the Data Lab, from the community, Thank you, Patrick, for being our host and really being a material part of this conversation. I hope this is a conversation. I can go on and drone for a long time, but it's always better if we can make this more interactive. So I really encourage everyone to use the chat function and to enter your questions as I go through this story. And I'll be happy to field questions and to talk in more detail about the work. So as you know, I'm Beth, and I run the Centers for Civic Impact here at Johns Hopkins University. I'm going to do a more detailed introduction of myself so I can sort of talk about how I landed where I am now, and then I'm going to talk about the genesis and the evolution of the work that I'm doing on the Coronavirus Resource Center here at Hopkins. So one of the things, I think we're all having COVID realizations this year and last year. And I think one of the big COVID realizations that I had is that my life and my story have been marred by pretty significant disruption. Disruptions that led to just a change in course in the way that I thought about the work that I wanted to do. And it's funny, Anne's sitting in front of a bunch of rocket ships in the back of her background. And, you know, I dreamt as a little girl of always wanting to be an astronaut. It was kind of it was my biggest dream. And then we witnessed the challenge together as a nation. We witnessed the Challenger tragedy. And it was in that moment, I was a young girl, I was in school, and I realized I don't want to be an astronaut anymore. I'm going to have to think differently about my life's work because I was really deeply deterred by the notion and I really didn't want to do the work given what could potentially be the outcome. And so I started to think about science differently and think about my approach to my future differently. And that was the first time in my life, I think, that I really did acknowledge that you can catalyze disruption and actually channel it into change and to think differently about life. And that's something that I want to challenge everyone today as we talk about this work, to think about how you're going to catalyze this disruption in all of our lives as you think about the work you're doing now or the work that you will do. I was also working on Wall Street at the time of 9/11, another huge disruption. I had taken a non-traditional path and ended up at a hedge fund in 2001 in the World Trade Center complex, where I was not at work because I had broken my foot the day before. But when when the plane struck the Twin Towers, the complex where I was employed, I had another pretty significant disruption in my life. I had to really take a deep look at what I was doing and how I was contributing to the world. And I decided it wasn't on Wall Street. And so spared from the tragedy of 9/11, I returned home to Maryland, where I deeply invested in a career in the public sector. And I got a job as a probation officer, probably one of the toughest jobs that you can have. My clientele were all juveniles, so children who've been charged with pretty significant crimes. And I immediately fell in love with two things. One, I fell in love with working in the public sector. I felt every day like I was contributing to improving conditions for people. I was improving the lives of children and their families. But I also fell in love with the sort of notion that government can actually deliver, but that there were real impediments to that delivery. And one of them was data. And I was asked to make really significant decisions in the lives of children and families. And I was doing that with just a police report and some anecdotal information I was garnering from a family interview. And it was a wasted opportunity. If I would have had at my disposal more integrated data that would tell me about, you know, whether or not that child was in school that day, or whether or not there was a social worker involved in that child's life, I think I would have been able to make better decisions, and I would have been able to certainly mobilize services in a lot different and dynamic ways. And so I became quite a vocal advocate for using data in government in smarter ways and in ways that really did improve conditions. And it was that work and that emphasis on data that, you know, in government, I don't know if this is the same in Delaware, but certainly in Maryland, when you're the squeaky wheel, instead of firing you, they promote you. And so I rapidly got promoted in the state of Maryland. And by the time I left the state after nearly or over a decade of service, I was the de facto chief operating officer for the state. I oversaw about 80% of our state's budget and a comparable amount of our workforce through a program called State Stat and the Governor's Delivery Unit. And really at the center of all of that work was just How are we using data, and how is it framing and shaping our most intractable problems? Everything from reducing crime, which we got to historic lows using data. We were able to improve for the first time, turn the tide on the health of the Chesapeake Bay, which many of you know in this region is sort of the lungs of our nation. We were able to improve infant mortality outcomes. We were able to reduce hunger in child populations, all really lofty and ambitious goals that had never really been tackled before, and certainly never using data to really validate and verify the interventions that we were extending. And that was really what led me into thinking about how I could do this at scale for government. And then perhaps the biggest disruption in my life, I had left government and I was working in the private sector, traveling around the world and building a software platform to enable governments to really use data to align to outcomes. And very tragically, my husband, my partner, who was also a stay-at-home parent raising both of our kids, was diagnosed with terminal cancer, and within several months died. And it was at that moment that I realized again that this disruption in my life was going to have to be a catalyst for change. And I was at the time very much focused on the notion that local government could do good, but it needed help. And there was another person in my life and another organization that was thinking along the same lines, and that was the Bloomberg Philanthropies. And they brought me in to help really understand how we could start using data to really think about the scaled ability for data to change conditions in cities. And they were launching several cities initiatives at the time. And I got brought on to start a center here at Johns Hopkins University that's focused on enabling these capabilities in city halls all across the globe. And for the last 5 years, I've been working with north of 200 cities as we've been building out the capacity for those cities to use data to align to outcomes, to think about advanced analytics as a way to accelerate outcomes. And that brought me to March of last year, actually February of last year, is planning to go to India to do some work in cities across that country. And I knew there was this virus that was in China and that was growing, and I wanted to get better insights. And when I started to kind of poke around to figure out the best way to understand the impact this virus was having, I realized that it was right here, less than 2 buildings away from where I was sitting, was the beginning of this nascent effort to track the coronavirus. And it was with a colleague who I knew. And so I reached out to Dr. Gardner and I said, I'm planning on going to India next week to do some work. Would it be prudent? What are you thinking? What are you seeing? And within a few minutes, I knew I wasn't going to India. And within a few days, all travel was essentially starting to slow across the globe. And I also realized another thing, that this was coming to the States and that we really needed a granular view of this data, particularly for these cities that I've been working with, to allow them to use what at the time and really to this day continues to be our best tool to fight the coronavirus, which is public policy. And so Dr. Gardner, who had been working with her grad student who had happened to be from Wuhan, China, and had come to her and said, you know, there's this virus, I want to track this thing. They had already done some similar tracking in other efforts for other disease. And so they started to do this work. And I said, I would like to help you. And I would like to do that with looking at the US data and figuring out how granular we can go. And so our work expanded, and I started to build a small team in my organization with Dr. Gardner as my co-pilot. And we started to look at how we can start to depict this virus as it started to hit our shores here in the United States. We created a dynamic process for not only inputting data, but validating data, creating verification, really understanding the data landscape down to the most local level possible. So we now at the Coronavirus Resource Center are able to track the progression of this disease at the county level, which is the most granular right now. We're getting some metropolitan areas now that are reporting, and we're starting to do some of that, isolating some of that data. But we also wanted to start to tell a different story. One of the very early observations that we made was that first, testing was a little bit of the wild, wild west. And to be able to validate whether or not you had cases, you needed to have a testing program. And there were no standards at all that were being generated from our stalwarts of health, like the CDC and HHS, on how we should be talking about this disease and thinking about it, let alone how we should be measuring it and how data should be collected and shared. And so we started to look really hard at the way that data was being used. And we wanted to do that with a couple of really critical lenses. The first one being, we knew that there were going to be some huge health disparities, not only in the way that the disease was going to be impacting populations, but also the way that populations were accessing testing and care. So we started very early on with a county-based dashboard that you can see here in the slide that really kind of shows in 3 critical domains the way that we look at the disease. 1, how are people accessing healthcare? 2, what does it look like in their communities? So what are the demographics of local communities? And 3, what does it look like, the spread look like? So the case counts, we did a fatality rating, and we also were looking at access to policy decision-making and testing. And we wanted to be able to show that. So now when you log on to the site, you can see in this granular detail, and this is an evolution, this is a data set that is evolving. Everything that we display in visualizations is available in a GitHub repository on our site. So users have not only just been using our site, but they've also been going behind the scenes and pulling data. So while we get at the CRC, we've had over 1 billion views of our site, we've had over 10 billion calls to the data. So there are lots of live calls coming in and out of the data, and we've built a data infrastructure that's been able to absorb that kind of traffic. This is a closer, a zoomed in version of that kind of granular look. And again, we're trying to very much emphasize these 3 domains because they continue to be the domains that are top of mind for practitioners. The age of your population, those comorbidities that are exacerbating those outcomes, and again, the racial and ethnic background of those geographies that are hardest hit by the disease itself. And then we started to think about, the fact that, hey, we're in one of the most important leading health universities in the world. How can we really take advantage of that subject matter expertise and start pairing some of our data and analysis with some of that public health knowledge, medical knowledge and information. And so we created a series of critical data, and we're pairing it with that kind of narrative that's really being derived from our public health experts that have been guiding our work from the very beginning. And so we have a gallery of different views of the data that we've been building in terms of visualization, and it's all contextualized with public health information. So one of the things that I think is most notable about the site is who's coming to it. It's not just researchers. We built a site initially because we thought it was going to be for researchers who were going to be studying the progression of disease and modeling, and we wanted them to have the best raw data. And what we found is, like my parents are logging in every day to see whether or not they're wearing PPE when they are going to collect the mail in the lobby of their building, or whether they're going to actually go to the store or have their groceries delivered. We have a lot of lay users on the platform that have been regularly looking at the materials, coming back, referencing them, and really thinking about the data. And this really is quite a pivot, a change from the sort of business as usual that we see. one of the things that we did observe very early on was that we rely on public data for the majority of the data that's displayed on the site. And one of the areas that we emphasized was that we wanted to see the data broken down by race and ethnicity, so we could observe from the earliest point possible these health disparities, so that we could inform policy decision-making in real time, but also so that when we go back and we look at what are the kind of things that need to reform within our public health systems, we know that health disparities have been plaguing the health system here in the United States. And we were really concerned initially because the data was not being broken down. When we first started what I affectionately call these maps as the name and shame maps, most of these states were great. They were not sharing data. They were not breaking it down by race. And as you can see, with deaths and confirmed cases, we nearly have 100% coverage of the United States with data that's broken down with this critical demographic information. The last frontier remains testing. And I want to flag this for everyone because it is a huge deal. And it's not, I mean, I'm screaming, you know, from as many hilltops as I can climb, including a recent op-ed in the New York Times, where I said we need more standardization for testing data, because what's happening is we know that there are huge communities that are just completely cut off from access to testing. And we suspect that they're largely Black and Brown communities. And it has already manifested itself in some of the worst outcomes. We know that if you are more likely to have not only the comorbidities, but have a much more acute experience with the disease. And race is a predisposition for that at this point in the country. And we still can't tell whether or not we're testing enough in vulnerable populations. And it's, for me, one of the biggest issues. And we're going to see the same thing with vaccination and whether or not we are equitably distributing vaccines. Earlier, I talked about the fact that public policy is by far our biggest tool for controlling the disease. And when I talk about public policy, I'm talking about everything from school closures and business closures to mask mandates, to curfews, to lockdowns. And what these series of visualizations shows us is the dotted lines that are connected are all different policy decisions that happened in these states at different times. And the data that's underlying it are confirmed new cases in those same geographies. So you can see in places that have been very aggressively looking at public policy as a tool, the way that the disease has responded. But you can also see that in nearly every single geography, except for North Dakota, we're still in a pretty critical state, and we're still, even with some of the most aggressive policies and some of the least aggressive policies, seeing cases climb. We have deep dives on the site around a number of other critical interventions. And again, next to public policy, contact tracing is also probably the next most effective thing that you can do right now to control the disease in the absence of vaccination and herd immunity. And so contact tracing has been growing throughout the United States. It's been uneven. It hasn't been consistent in its rollout, but it is one of the ways that we can get the best information to people who are testing positive and to their contacts. And so there is some really great data on the site that's been derived out of a partnership with NPR and the Coronavirus Resource Center that's really been looking and surveying the states for to really contextualize the effects of contact tracing on disease control. So the most recent addition to the site and evolving addition to the site is our vaccine tracker. The vaccine data, again, rolled out with very little information. The CDC is reporting data, which is really exciting. We're still pulling our data directly from states. So you'll see that our states are not completely pulled, but we create data scrapers and data methods so that we can pull directly. And we'll also pull in the CDC data to validate our information. And soon we'll have an international vaccine tracker that will include CDC data up against some of the other countries that are now reporting their vaccination vaccination data. This is obviously the newest part of our science, and we're looking really closely at it. We're still trying very much to figure out the best way to display this data. With the potential of having a new vaccine in the marketplace by the end of next month, that's a one shot, as opposed to the two that are out in the United States right now that are two shots, so one that requires booster. It'll be interesting to see not how this data gets visualized, and we're really very optimistic that we'll get some standards from the federal government around how to visually display this data, what's the best way to think about it. But again, we want to see it broken down by race, we want to see it broken down by ethnicity, by population priorities. And these are all areas that are not very straightforward, and we're certainly not seeing the data consistently reported in that way. One of the most impressive data sets to come out of the federal government throughout the entire pandemic was just last fall. The HHS did release a hospitalization data set that for the first time gave us the opportunity to see where we had stress in our health system. And so we just started pairing that on our region pages on the site. So you can see hospitalization data for the US, but you can also see that state by state. So you can see the bed availability, how much of our beds are being used for COVID patients, and kind of where we have potential overruns of capacity. We continue to work with mayors at the center. So we release guidance all the time. These are measures that we are recommending be used for public policy making. We've done it around general COVID tracking. We're also doing it around vaccination distribution, where we pair, again, public health resources, some of the best city thinkers in the world, and really trying to, we know mayors are going to be carrying the brunt, not only of the dissemination, but also of the recovery. And so we want them best equipped with the data that they're going to need to navigate not only us through to and through immunity, but also recovery, which are two slightly different things. And so we guide them through providing measures and metrics so that they can set goals, they can look at their progress, and they can also compare themselves and to other folks. And so this is one of the areas that I'll be sticking with for some time, even after hopefully the CDC gets fully up and running and their data becomes the source of record. I don't think any of us here at Hopkins ever thought in a million years that we would still be, for many sources, the system of record. And so, you know, we're actively trying to obviously understand the value of translational science, but at the same time, support our colleagues that are doing this in the federal government, because we know that there are some really great public sector workers that have been hard at work, both modeling and using data and collecting data. And now I think that we'll have an opportunity to see some of that work exposed in more tangible ways. And we're all really excited about that. So this is my contact information for the center. And if there, I think there are some questions, so I'm going to stop my share and hopefully we can dive into some of these questions. And I don't know, Devin, if you want to.
Yeah, thanks, Beth. One, thank you for the very informative discussion, and thank you for also sharing a little bit about your story and kind of how you got to where you are. So really appreciate that. But looks like we have a little over 100 people on the call, and a bunch of questions are filtering in now. So if everyone could please continue to add questions in that Q&A section. I'll do a little session with Beth right now. Beth, looks like we have a few data scientists on the call. And one of the first questions was, what is your advice for a young data scientist to find purpose in their work?
I encourage everyone to work in local government. I mean, I know that I might come off a little Leslie Knope-ish, but I just, working in state or local government has really been the highlight of my career. It's, you know, there was no chance in any other career that I would be able to have an intersection with the CEO as a very junior staff and expose work. And it was really based on just performance and my ability to actually roll up my sleeves and do work. And there's nothing I think that is more exciting than working on a team that's solving real problems. And government solves some of the real problems there are. It isn't always like the sexiest work, but it is sometimes the most impactful, where not only can you save money, but you can optimize services, you can make people aware of services that may not know that they exist or that they qualify. There are so many things, that you can do. And so there is a need for data science in government. And there's also a need for people who can translate some of the hard problems that government face into technical terms for the right kinds of analytic intervention. And I think that that is kind of a key thing that I really think is a missing skill in government that you actually learn as a data scientist. And so if you think about, like, in software, they have product managers. That role doesn't exist in government. And so you end up having people who are working in programs that can observe a problem, and they talk essentially directly to the engineers. And if you have ever been in a software environment, like, that is a really bad idea. And so, this ability to be able to really understand a problem, depict it in the right way, and bring about the right solution is one of the ways that I think we can really contribute to the modernization of government, and the right technical modernization, not necessarily just kind of more business as usual.
Awesome. Thank you. And just a reminder to everyone, continue to please add questions to the chat or upvote any of the questions in there that you like. But Beth, the next question that came across was, what type of infrastructure is in place for scraping? Is that something that requires a lot of resources for the team? And how do you handle that?
So always at first, it requires a lot of manual work. So, like, if you think about what we're doing now for vaccinations, we're collecting all that data manually. So we've got a team, not very big, but very mighty, who is monitoring all of the state websites. We go through every single day, multiple times, to check for updates. And as we're building out the scrapers, we validate also manually. So there is an overlap time. And then once the scrapers are in place, we do data validations. So we have automated checks, we have manual checks. Our bread and butter is the quality of the data. And so we have a pretty significant infrastructure. We're very fortunate to have partners like the Applied Physics Lab here on campus, and our group here at Civic Impact. And also we continue to partner with CSSE. So between the three of us, we're working very hard on the data infrastructure, but we are not a team of 100+ people. We are a small but mighty team. So it's been a 24/7 project for many of us, but it has been worth it.
Great. Next question we had was from our own Jeff Headley. I'm sure some people either accidentally or knowingly misrepresent the data that the team is publishing. Do you monitor misuses and use that knowledge to improve your delivery and visualizations?
So we actually, we had a license change. I don't know if you're really like me, like a nerd, this was actually a pretty big deal, where we went from a pretty restrictive license to a Creative Commons, like an open source license, probably over the summer, I think, is when the switchover happened. But time, what is time in COVID land? At first, we were really trying to avoid commercial use. There was a lot of people that were coming to us that wanted to be able to essentially create views of the data in proprietary ways. And initially, we wanted it to be as free and open as possible and limit the number of paywalls people had to navigate in order to get to the heart of the data. But we realized that we would never be able to visualize the data to meet every need for every user. And so we went with a more open license that allowed the data to then be essentially used by a broader audience, which includes now it being in some proprietary systems. But there's definitely been some misuse. I think early on, one of the stories that I will remember is that there was what we call an armchair epidemiologist that looked at our data and tried to use our data as evidence of herd immunity, but in April. And it became like a viral story on social media. And we had to like be very clear, like this is not a representation of our research. And while our data is sourced in this analysis, it's not our interpretation of the data. And we certainly knew that we had not achieved. It would have been great to have herd immunity by April, but that was not the case. And so, yeah, there have been some times where we had to call and to clarify. We get hundreds of inbound inquiries about the data a day. We don't respond to everyone just because we don't have like a 24/7 call center, but we try to filter them. And when we get mass inquiry, we update our FAQs all the time. And many of those updates are responsive to questions about the data or representations of the data that have been called or highlighted for us.
The next question has about 6 upvotes, so everyone wants to know the answer to this, but what is the tech stack that's used for the dashboard?
So for the global dashboard, we're using Esri tools. And so it is, you know, an Esri, and if you are a GIS user, you'll recognize it immediately. The data collection methods are a mix of tech. So we're using a lot of scripting that's written in a lot of it is Python, and we're building. Some are in proprietary systems, the way that we're scraping based on who's doing the scraping for what, and then the visualizations are a mix of D3 and just like very straightforward Python and there's a whole bunch of different things on the visualization side that we're using. It just depends on what we're trying to accomplish. And then on the Esri side, we're using a lot of the different Esri tools, including some of their data. And so you can get all of the information on the tools that we're using on the FAQ page. And in the GitHub repo, you can see a lot of the like coding too. And I'm the least technical person. I think someone said like, what's my technical data science background? I am self-taught. I built a website in college. It was an absolutely fabulous fan page. That probably goes over anyone who's younger than me's head. And I then taught myself how to code as a hobbyist. My degree is in law. My undergraduate degree is in women's studies with a concentration in math, which makes no sense. And all of my data science I've learned from other people, and all of this work, you know, my work is really on understanding how to democratize data visualizations in a way that actually lead to change. That's been the kind of niche that I've in, and I've relied on lots of technical people to carry me through. And I've learned a lot along the way, but I have a chief data scientist who I talk to all the time, and she's much smarter than I am, and I'd be happy to connect you to her. And she can take you through our process in much more accuracy and detail.
Great. So you answered that one for me. I didn't even have to ask the question, but thank you. I appreciate it. And then we also have a question from Stephen Rice. What are the pros and cons of federal versus state or county-led initiatives in the area of public health and specifically data-driven decision-making?
Yeah, so I mean, I think we learned a kind of tough lesson in the last 4 years that if we put all of our eggs in one basket, it's not going to necessarily work out the best for us. And so, you know, look, we had a real big challenge at the CDC for the last 4 years in terms of leadership, and it made it tough. But the thing is there are some really incredibly smart people that work at the CDC that are still there, thankfully. I mean, I think that we would have been in much worse shape and there were some that were working behind the scenes, that were working really hard and putting pressure in all the right places. There were some definitely voices that got silenced in this process. And that is for me, like one of the biggest tragedies, that science was silenced. And, you know, look, this whole disease in this country is politicized much more than it is anywhere else in the world. And so now, like, wearing a mask is a political statement in many places still in this country, which is devastating. I mean, it's just devastating. You know, there's still people out there in our country that think it's a hoax, even though their neighbors and family members are getting sick and dying. And so, you know, I think we really need to think about public health infrastructure in this country, and healthcare as a human right, right? I mean, I think that we also learned that these health disparities that are that have presented themselves through COVID are absolutely not a surprise to any seasoned public health professional in the United States healthcare system. They have been part of the problem for a while. And so I think as like one of the big things that we're going to take away from COVID is a real reassessment of what public health means at a local level. And we need access to our local data. We need more resources at the local level, especially if we're in another situation of pandemic. And the locals were told essentially to navigate this on their own. They were given some support, and so there was a little bit of support initially, but for the most part, state and local government really had to lead. And they've done as good a job as they possibly could, given the landscape. And we see a lot of states that, you know, have been very innovative, have used the levers of public policy in very smart ways, have really asserted themselves, all with really under-resourced public health organizations.
Awesome. And I know I'm being wary of time, so wind it down. I think we have 2 more questions that I'll get to, but this one was asked twice. What are some ways a person could begin a data path into government, knowing that you've kind of had a winding path to where you're at?
Yeah, I don't recommend the decades-long emergence into. I think there are plenty of opportunities. So I would look at your local job boards, and there are also fellowship models. So I think, you know, there's a great one that's happening in Delaware now, right, where you can start to engage and start really partnering in some of these fellowship models. Code for America is another organization that does a lot of really cool national work. So there are these models that will get you, and then I think there's going to be a huge opportunity at the federal level too. So if you're interested in federal policy, places like the United States Digital Service and places that are going to, you know, are the Department of Commerce and, you know, the place that runs our census, some of our most important data that we use across the board in government. These are all areas where there are some really cool jobs that involve the use of data and the application of data to solving problems. But at the local level, there are innovation teams. So innovation teams that are solving problems, that are always looking for analysts, that are looking for data scientists to come in at the city hall level. And then in each of the departments now, we're seeing a growing number of jobs at the city level and at the state level for data and analytics folks. The real challenge, to be honest with you, is the HR structure in government. Oftentimes these jobs are coded with really weird names. So you have to read the job descriptions to see whether or not it's actually a data science job or an analytics job, because it's coded something bananas like advanced database manager or something like that. But what they're really looking for are some data chops to help them solve cool problems. And you kind of have to do a little bit of detective work to figure out whether or not those jobs are the ones that are right for you.
Very well said. And the last question, and thank you, Juan, for telling your personal story and the traumas that have kind of impacted your journey. But how do you balance work and life, particularly in the context of personal struggle and this collective trauma we're all going through right now with the pandemic going on and affecting all of our lives?
Yeah, I mean, I think like we all need like one giant trauma-informed care therapy session as a civilization. The mayor of Baltimore actually is insisting that all of the directors get trauma-informed care training. You know, look, I'm a single mom. I'm an only parent. I've got 2 kids. One is a teenager, one is about to be. And we're here and we're doing the best that we can. And some days are easy and some days aren't. And, you know, some days we figure out what we're going to binge on Netflix and order in for dinner. And we have the ability to do that, which I'm really thankful for. I've got a job, I've got a house. I kind of count my blessings in that regard. And other days, you know, it's hard. And one of the things that keeps me going is knowing that I'm doing work that is making a difference. I wake up every day where I really do honestly feel like I'm improving the conditions for people that are living in cities, and that people that are living in the world. And I think that really kind of helps us in our darkest hours, when we know that there is what we're doing is contributing and filling up cups, and then sometimes you just got to lay in bed and binge watch TV. I mean, that's, I think, the balance that we're all living in right now. I love walks. I love listening to punk rock music. I have outlets of my own, and I think that, we just have to kind of lean into all of that as we continue to bear down and navigate this thing.
Well, I mean, I said one last question, but you brought up Netflix. So what's the show that you're binging right now?
Well, on Netflix, I'm watching that guilty pleasure Bridgerton show, but I can't really get into it. All of my friends are like, you have to watch it. But I haven't totally gotten into it. But I will say that I've been watching a lot of old school reruns of shows, just like mindless things to keep me going, including Absolutely Fabulous, which I do encourage everyone to watch if you haven't before, because it's hilarious and it will keep you going.
Amazing. Well, thank you so much for your time and for telling us your story. It was amazing to have you, and just would love to stay in touch with you, obviously. And thank you again.
Yeah, thanks for having me. And I love Willie Nelson too.
What's the punk rock?
Oops.
Come on, what's one punk rock that you're listening to?
Oh, me?
Yeah.
That's a very hard question. I'm a Riot girl, so anything, I always have Bikini Kill on rotation on my playlist, and all of the DC Discord entire catalog. So I'm really an enthusiast and would be happy to talk to anyone about punk.
Thank you so much.
Yeah, thanks for having me.
Yeah, thanks. And thanks for everyone who tuned in. Also, don't forget, next month we're talking about transportation during COVID and data behind that. So hopefully you can join us next month as well.